Thank you, Paddy, and good afternoon. I'm very pleased to participate in the city health. This is first time when I'm taking part in this important forum, and I welcome very much the fact that TB is getting more attention on the agenda for the local authorities and for those partners that are working at the local level to bring TB on their health agenda. It's a very timely, I would say. Basically, in a week from now, in New York is going to happen the first ever most important meeting dedicated to tuberculosis. It is about high-level UN high-level meeting on TB. It's on 26 during the General UN Assembly, and I would say that this is a first time when UN bring tuberculosis at that agenda. Those who knows HIV had already 4 meetings like that. The first one was in 2001. So 17 years later, we came to discuss tuberculosis. So I would say that we lost 17 years in terms of getting more ambitious and getting more bigger commitments to end TB in the world. Those who are from HIV, we have been discussing this morning that there are a lot of wording and approaches that we used in HIV are currently present in TB agenda as well. We also talk about 90-90-90 targets, and it is about like to reach 90% of those who are in need, and those who are in need should be 90% out from key population groups, and to achieve at least 90% of treatment success in those covered. So these are the targets of the global plan to end TB. Which is part of the bigger end TB strategy. When designing the programs on the ground, when looking what we can do at the local level, of course we need to embed and to arrange all our programs to be in line with what is happening in the world. And currently, if looking on tuberculosis, there are about 10 million people estimated to get TB annually, and we only find about 6 million of them. So 4 million still are not notified by the health systems, and that's a big problem at the global level. If to look on drug-resistant tuberculosis, we see that we miss out of 600,000 estimated, we find only roughly about 100,000. So 500,000 are missed as well. If to look on success, how successfully we treat those who we diagnose with TB, you see that 1 in 2 is successfully treated when we talk about susceptible TB, and 1 in 10 is treated successfully when it is about multi-drug resistant tuberculosis. So there is an initiative called strategic initiative supported by the Global Fund at the global level to find those missing people with TB, those 4 million that I mentioned. And in this graph you see the biggest contributors in the world in terms of those cases. You will see Ukraine as well. in here, because maybe for our region it is not about missing people with TB, but it is about to diagnose them earlier. Our biggest problem in the region is we diagnose people with TB at the late stage of the disease. So basically, if talking about the interventions, they are the same. In terms of find them early, it means to do active case finding, or to stimulate active case finding. I just wanna show you which is the program, which is the problem at the global level, and to see that one country from our region, which is Ukraine, is also part of this strategic initiative, and also received the catalytic funding, which is additional funding to the country allocations from the Global Fund to catalyze activities in terms of early detection. Looking on the cascade, because those who are from HIV also very familiar with this wording, right? Looking on the cascade in terms of TB, HIV co-infection, you see that we have about 1 million estimated cases a year, and we diagnose TB, HIV co-infection in less than a half. And we provide antiretroviral treatment in about 39% of those who are in need, which is also a big problem at the global level. Recently, the Stop TB Partnership and WHO developed a joint initiative which is called 40 by 22. It means to find 40 million people and put on treatment by 2022. And the targets have been updated to be in line with the recent surveillances that we had. So when we talk about the activities that we need to develop at the ground, that we need to develop at the local level, because basically when activities are aggregated at the national level and then at the regional and at the global level, we talk about that primarily the local level is very important, right? Because the TB, we call the TB pockets are there, right? So when we approach TB, it is about to approach this in a comprehensive manner. And we say search, treat, and prevent. Very often we forget that we need to prevent. We have a big problem in terms of latent infection, and we need to do screening of the latent infection, and we need to do prevention of the active disease in those groups. There are some examples around the world that active case finding and comprehensive approach in terms of search, treat, and prevent works. And I have a few slides here showing some experience in the United States, in Tomsk, Russia, in other in Karachi. I would like to mention that we, together with the Alliance for Public Health Ukraine, we are part of a regional project called Cities. In 5 cities in the region. It is about Odessa, Belts, Tbilisi, Sofia, and Almaty. And Stop TB Partnership is a technical partner in this initiative. And together with the Alliance for Public Health, we are trying to bring the new approaches and the new thinking and strategies to work at the city level, at those levels that we, as I said, call them pockets for TB. It is important to say that we Stop TB at the global level. We lead an initiative called Zero TB Initiative together with Harvard University and other partners, and we do these approaches at the global level, and we have a very good examples in the world where we have local authorities and city authorities achieving great results at the ground by approaching comprehensively the TB issue by search, treat and prevent. When we say comprehensively, we would like to mention few issues which are very important at the moment when we build this at the local level. It is about to build our programs around the people, because around the people who are in need, because they are those who are basically requesting the services. So we in TB started to address more and more the issues of key populations because somehow the TB world didn't explore this sufficiently in terms of having key populations in TB. And currently we identified more than 10 key populations to be addressed right now, and working with the countries in terms of mapping and prioritizing those populations at the country level. It is about addressing stigma and discrimination and reducing human rights barriers to services. And I mentioned this morning, and I will say again, that in tuberculosis we didn't use human rights perspectives in our asks, in our advocacy. We didn't say it's our right to have access to new drugs, to bedaquiline, to delamanid. It is, we don't say it is our right to ask, it is our right to have access to gene expert and so on and so forth, what we did a lot in HIV field. And of course, it is about reducing gender-related barriers to services. So this is very comprehensive approach, and we recommend this to do at the local level as well. We have, as I said, we have few very well documented practices already. It is about One Impact digital tool that we are rolling out in 12 catalytic countries plus Cambodia and Tajikistan. Right now, it offers people a means to be engaged. They do a social monitoring, they increase their literacy, and they participate in the day-to-day work at the grassroots level. We work with the civil society and community to embed them more in TB, because TB is very, very reluctant to bring civil society and community on board compared to HIV still. And it is also about to have support, financial support as well. We have currently the Global Fund still present in some countries in our region, but also we see that there are gaps, and those gaps should be in time taken over by the local and national authorities. So that's very important when we design those programs, think in advance and allocate money, additional money. We already have a lot of examples when the local authorities support a lot those search, treat and prevent activities at the ground. So as a conclusion, it is important to improve the demand of the services, to increase the asks for the services, to accelerate the uptake of the preventive therapy, to increase allocation and use of funds, to address and remove barriers to services. It is important very much to change the mindset when we do that. And of course, it is about to think about accountability at the local, at the national, and at the global level. Thank you very much for attention, and